Hello everyone, here we are with a patient who's come to us for a consultation for a rhinoplasty surgery, and the main issues that he has is that he's having a flat nose, lack of tip support, a broad dorsum, and he does not have any breathing difficulty as such. Do you?
No, I don't.
No. Okay, so it's going to be purely a cosmetic rhinoplasty and not a functional rhinoplasty. So what he desires is he wants an augmentative rhinoplasty, augment the dorsum, narrow the dorsum by doing a radix osteotomy. If you see, he has no tip support, so we are going to do a tip graft, marginal rim grafts, and a bit of alar base work. So overall it's going to be an open structure rhinoplasty which will be requiring a rib harvest, and this procedure should take us about 3 hours. Are you scared for this? Is this your first surgery?
Yeah.
Are you scared?
A little bit nervous.
It is okay to be nervous, but you should know that it will be smooth and you will be under general anesthesia, so you have nothing to be worried about. The post-op pain is also controlled with medications. All anti-inflammatories are given because you will be having some amount of edema around the eye, because we are going to do some osteotomy here to narrow the dorsum. Osteotomy means some fracturing of the nasal bone. So that will cause some blood collection around the eye. And you shouldn't get scared. It's just a normal sequelae of a rhinoplasty. Okay, all that will be controlled by medications, and you'll be fine. By the time you leave from here, you'll be good to go. Thank you.
Okay, no problems. So your main concern is your nose.
Yeah.
That's right, that's enough support. Can you smile for me? Okay, open your mouth. Say ha.
Ha.
Close. Have you had any procedure so far on the nose or anything? Absolutely nothing, right?
Nothing.
Okay, I'm going to show you scans as well. See, you are having what we call as a little bit of a nasomaxillary hypoplasia, meaning, see, there's no bone inside and this area also is inside. It's not just the nose.
Yeah.
So I have to do little work on this part of the nose, of course, all this part also, and then we can give you a good result. So we'll have to probably harvest some rib, and then only we'll be able to work around with you.
So that hypoplasia, up to what extent it can be corrected?
5 mm.
So will it appear to be like this?
Yeah, it will appear like that.
Will it be okay?
You'll not need anything, I'll sort it out in one go.
Okay. Because I just want my side profile to be good.
Yeah.
Because it looks little bit.
It's totally inside.
Yeah.
Literally your nose is within the lips, so
Yeah.
we'll be able to do that. We'll do that for you.
Also, a tip. What kind of tip I'll be getting? Because
Nice normal tip. I mean, the problem is your whole nose is sunken in, so we'll have to bring it out. Once you bring it out, you automatically get a.
it looks little droopy also.
You get
so
a
I
much
want it-
better tip. Yeah, you get it. And when do you want to get it done depends on that. We can do your blood tests and all of that.
So when it can be done?
Tomorrow morning we can do it, because we already have some cases for today, and I'm a little late as well, and there's a baby that's just come, so we probably are going to be busy till tomorrow morning. Tomorrow morning we can start early, like we can start your surgery by 8 a.m. So then you finish all your bloods, meet the executive for the payment, and they give you an appointment for tomorrow. You have to come fasting, like not have anything to eat or drink in the morning, in fact after 12 midnight today. And then plan to stay for about 7 to 8-9 days, little more than 7 only in your case. So give it 2 days extra, I think. So tomorrow being what, Wednesday?
Yeah.
let's say the Friday after that should be a good day for you to leave.
Okay. On
So
Fridays,
laterally, yeah, it's better because see, normally we do what is called as a septorhinoplasty, or we do septoplasty, or we do rhinoplasty. In your case, I have written, you see, this is extra. So it's a septorhinoplasty because I have to work on the septum and rib, which is also we do for a lot of patients, but we're also doing pyriform rim work.
Okay.
Pyriform rim is the part of the nose that's actually on the upper jaw.
Okay.
Literally the sides of the nose, pyriform is pear shape. That's how the name pyriform comes,
Okay.
So it's a pear shaped depression on the upper jaw that's also sunken in for you. So for
Doctor,
aesthetic reasons, we'll have to bring it out.
I've seen in your few of the videos, like the nose will start from here. It'll be,
Yeah.
it'll have the same level. So I don't want that. I want a little depression here because.
Okay, no, I have not mentioned that point at all. I don't think we need that.
Okay.
And also see what happens is there will be some swelling, and we are doing the surgery from this part of the nose. There's no cut or incision on the other end of the nose.
Right.
So what happens, all the fluid that gets collected, it shows as a swelling. The edema on that area is more visible for a few weeks. It just disappears and goes away.
Okay.
This is not something you have to
Also,
be
like,
worried about.
Normally I'll touch my nose, mold my nose like this.
You'll
So
have to wait for a few weeks before you do that.
So like
6
I'll be
weeks,
able to
4
do
weeks.
that, or,
Of course. Of
or
course.
I'll have to take extra care of it.
Well, initially you shouldn't touch. After a while you can do what you do with it right now. There's no problem.
Okay.
Alright?